Thanks for watching On Call for All Kids. Today's topic is about ear infections. We'll be discussing common symptoms of an ear infection, how to reduce your child's risk of getting one, and the best treatments if your child has been diagnosed. I am joined by Dr. Rachel Dawkins. She is the medical director of the Pediatric and Adolescent Medicine Clinics at Johns Hopkins All-Children's Hospital. Happy to see you, Dr. Dawkins.
Thanks for having me, Ashley.
So it's called otitis media. That's the medical term for ear infections. What is this? We know it's a rite of passage almost for all kiddos.
Yeah, so otitis media, or the common ear infection, is an infection of the middle ear. So it's not an infection of the part of the ear you can see, but it's what's behind the tympanic membrane. So it's a little further in the ear, and it's super common in infants and kids, mostly because of the anatomy of their ear is a little bit different in kids than in adults.
How does this typically happen? Does it happen when they have a cold or something like that?
So sometimes it can happen after a child has a cold because their anatomy is a little bit different. Sometimes some viruses or bacteria can get trapped behind the eardrum or the tympanic membrane and can lead to either a viral or bacterial infection.
That makes sense. So if we have a baby who's maybe like pulling on our ears, is that indicative that they probably have an ear infection?
No, so this is probably one of the funnest things that parents get worried about, and they come in and I can reassure them about. So babies often pull at their ears or tug at their ears or hit at their ears because it's really soothing for them. It's a way to self-soothe. So sometimes if they're feeling tired or maybe teething, they might pull or tug at their ears. And it actually is likely not an ear infection. There are other signs that also can show ear infections. I always tell parents that at 4 months old, they learn where their ears are and they also learn where their feet are, and they put their feet in their mouth, but no one comes to the office for that. They only come when they're tugging at their ears.
Well, what are some common symptoms of ear infections?
Yeah, so we think about fever. If your child's having fever, if they're extremely fussy, especially when they're lying down because the fluid is settling in that middle ear. If they're really pulling at their ear, and maybe if they have some other signs like, nasal congestion or cough that might be associated with a virus. But fever is usually a big indicator to us.
Well, what is the best treatment for an ear infection then?
So you probably would be surprised to hear that no treatment is usually the best treatment for an ear infection. Most ear infections are viral, and they've actually done studies that show after 10 days, most ear infections will resolve themselves. But, this is a good time to talk with your pediatrician to see if your child really needs antibiotics for their ear infection, or if we can just do what we call watchful waiting if the ear infection improves.
How can we as parents help reduce our child's risk of getting an ear infection?
Yeah, so there's lots of things that we can do, and probably the number one thing is avoiding secondhand smoke exposure. So if your child is exposed to secondhand smoke, we know that increases their risks for ear infections. Also, good hand hygiene, which is always important, and making sure, if your child is sick, not to take them to somewhere like daycare where other children might get sick. And then the other big thing is breastfeeding. So if you're able to breastfeed your child, there is a decreased risk of ear infections in babies that are breastfed.
How about if you notice your child seems to have a lot of ear wax? What's the best way to clean the baby's ears?
Yeah, so earwax is super common and very normal, and everyone has earwax. So, my pediatrician always told my family, nothing smaller than your elbow in your ear. And I bet everyone's trying to see if they can put their elbow in their ear right now. You can't. But so no Q-tips in the ears. If you want to, you could take a washcloth and clean the outside of the ear, but nothing needs to go in the ear. It causes scratches, and it actually can push the wax further back in the ear. And in worst case, it can perforate or bust the eardrum.
Well, Dr. Dawkins, thank you so much. Really appreciate all this information about ear infections with us today.
No problem, anytime.
And thank you all for joining us as well. Don't forget, you can also check out our website. It's HopkinsAllChildren'sHospital.org/newsroom. You'll find a lot of other timely topics in pediatric healthcare and other great resources as well. We will see you next week.